Okay. It is recording. Yay.
Okay, well, good evening, everybody. My name is Rebecca Altpeter. I'm the head of school at Dearborn Academy, which is a therapeutic day school that serves students with social, emotional, and learning needs. And I'm so honored to introduce our facilitators, Sheila and Dana, and our guest speaker when she arrives, Peggy Chapman. So first, Dana Mann is a licensed mental health counselor at Dearborn Academy. Dana graduated from Boston College and has experience working in hospitals, schools, and outpatient clinical settings. Among her many other responsibilities at Dearborn Academy, Dana co-facilitates our Caregiver Trauma Group, which is a 10-week group aimed at helping caregivers who have experienced complex stress and trauma from caring for a child with mental health struggles. Sheila, who has left, I believe, to go help Peggy. Peggy is the principal and clinical director at Dearborn Academy. She's also a licensed independent clinical social worker and educator with over 20 years of experience working with and advocating for students with complex mental health needs. Sheila has children who are ultimately diagnosed as PANDAs, which you're going to learn about tonight. And Sheila co-founded the Massachusetts Coalition for PANDAS legislation, which successfully championed the passage of both insurance mandate and established a permanent Department of Public Health PANDAS Advisory Council, where Sheila serves as co-chair. She received the 2020 Commonwealth Heroine Award and Boston College School of Social Work's Distinguished Alumni Award in 2024. And she is just a force for kids and families, and we're so lucky to have her. Peggy, who's going to be the headliner when she comes, is a clinical nurse specialist, board certified in child and adolescent psychiatric nursing. Peggy received her Bachelor's of Science in Nursing at Creighton University in 1976. In 1982, Peggy graduated from Boston University with a Master's of Science in Nursing and was certified as a clinical nurse specialist in 1983. Peggy has worked in various capacities in the Omaha and Boston areas, including as head nurse of child, adolescent, and adult psychiatric units, as a therapist for child, adolescent, and adults, and as a psychopharmacology specialist for all ages since 1988. Peggy co-led the Asperger Association of New England Parent Support Group for 11 years on the South Shore. And from 1999 to 2006, Peggy was a Defeat Autism Now practitioner. She treated her first PANS patient in 1999. Peggy currently integrates the principles of functional medicine into her practice and frequently presents to fellow professionals, parents, and educators regarding the use of nutrition and psychiatric pharmacology for children and adolescents. And most close to us, she has been instrumental in helping us achieve diagnostic clarity for a number of students at Dearborn Academy since she began consulting with our school in 2019.
Good evening, everybody. As soon as I can calm my anxiety and adrenaline down, I'll be much better. Okay, so I am talking about PANS and PANDAS tonight and trying to give you an overview. I'm trying not to get too specific, too scientific, or too in deep because it'll just make it harder. But there will be question and answers. And Sheila, if you please give me some timeline since we're running 10 minutes late. You tell me when we're close to the 20-minute mark or wherever you want me to go, but give me a 10-minute notice before we get there, if you could.
Yes, I certainly can. Yep.
Oh, all right. All right. And what is this? What is this? Okay. So what is PANS and PANDAS? PANS is an acronym for, the computer keeps loading something. Hold on a minute. It must decide it wants me to do something else. Like Teams. Yes, there it is. Okay. Pediatric acute onset neuropsychiatric syndrome, which is an overarching statement for what you might have also heard as PANDAS, PANDAS, which is this illness specifically to streptococcal infection. It was also the original designated illness until 2012. It started by an article by Susan Sweeto out of National Institute of Health in 1998 was their first publicated article, and then they updated it in 2012. What is it though? PANS and PANDAS is a condition where a subset of children and adolescents experience encephalitic-like, which is inflammation of the brain, onset of neuropsychiatric symptoms. And these symptoms occur following an infection, such as strep, mycoplasma pneumonia, viruses, mononucleosis flu, and I would add COVID here. COVID's been really nasty for a lot of people. And what happens is the antibodies react to, and I'll show you some description of this, but the antibodies react to this illness by creating antibodies, which is what they're supposed to do. But these antibodies become misdirected and attack a part of the brain, which I'll show you shortly, called the basal ganglia. This autoimmune reaction results in psychiatric symptoms called neuropsychiatric symptoms, and yet it is a medically driven illness. Both of these illnesses are diagnosed by clinical history and examination and not lab work, although lab work is used as a supportive element for kind of some confirmation if I'm looking for strep exposure, or perhaps tells me about things like autoimmune antibodies and some other elements that are helpful to know. This, everybody, is the basal ganglia. Is my arrow showing? I hope. And it's the blue with the purple and yellow around it. So the blue is kind of basal ganglia. It's made up of a number of parts. And then in the front is the frontal cortex, which is where your brain and your thought process and your decision making is. The auditory system is right behind it. Very importantly, what you call the amygdala is right down here, which is the fight-flight section. And the limbic system is the emotions. Back here is visual. Up here is motor.
Peggy, your
Yeah.
mic is a little muffled. I'm not sure why. I don't know.
My voice?
Yeah, your mic, like it's muffled. I don't know.
Let me try and turn it off and go on again. Hold on a minute.
Okay, that's okay. We'll just keep going, but just, okay.
Is it still bad?
It's a little bit better.
Okay, let me see if I can turn up my volume. I'm not sure that's going to matter, but I'll try. The average age diagnosis is predominantly 4 to 9 years old and 4 to 13, really, 10 to 13, because these are the years where strep occurs. But in fact, it's also much more than that. We see it in young adults in their 20s going towards 30. We see it in younger children. At least we can track it back to when they were 1 to 3 years old, when they actually started having the illness. It's a spectrum, so it's very wide, and I'll show you a little more wide later in its presentation. In fact, there are many options to pick from in the diagnosis as to what it could be, how it expresses itself. Immune-based conditions are found in most of these families, about 71%. And can adults have PANS? Yes, they can. In fact, there is unfortunately a brain bank at Georgetown called the Brain Bank, and it has a brain of a 26-year-old who started having her symptoms at 19, diagnosed herself kind of, and shortly before she started treatment, she died. And her brain was autopsied, and it showed basal ganglia tissue damage. Now, it's not clear that the damage would be permanent or that it would be wasn't a part of the inflammatory process, but it was noted to be different. If you happen to know of someone, unfortunately, to lose their life from this illness, it's really important you spread the word as fast as you can if they can help with the brain. The diagnostic criteria are the following. Either one of these two items are the main ingredient, either a sudden onset of obsessive compulsive disorder, which includes things like inappropriate thoughts, rigid rules, repetitive actions. And also OCD in these kids does not always look like what you think it looks like to most of us. So OCD is kind of thought of as a touching, tapping, counting, hand washing, kind of illness. Often these thoughts are very intrusive, very upsetting, but they don't act out compulsions related to them. So suicide ideation, compulsions around foods, sensory issues, but basically it doesn't always look like what you'd see on television, and most physicians and practitioners even think of as you have to be doing something like washing, counting, touching, tapping, arranging things. But many times it's hidden inside of their brain. It's more obsessive and not necessarily compulsive acting. Or the compulsion is to think or act on it, but not in a ritualistic, continual way. The other option is a severely restricted food intake. This is now known as avoiding restrictive food disorder, or ARFID, in now the medical statements. When I first used to give this lecture, ARFID wasn't really even talked about. I'm not sure how when it got identified. But it's a very narrowing of food choices: fear of choking, frank refusal to eat, will not swallow spit, have panic overeating. Often lots of food rules go into effect. In fact, it becomes very compulsive how they eat. And then it has to be accompanied by one of two of the following many symptoms. One of them is anxiety. Anxiety is huge. Generalized anxiety, phobia anxiety, separation anxiety, panic, agoraphobia, social anxiety, and probably others that I haven't even listed. Now, the problem is you have to kind of sometimes, for the practitioner, that's me, sort out if the anxiety is actually obsessional, as in bad things are going to happen if I do something like leave home, something bad will happen, or this extreme dread that they obsessively carry that if something's not right, it's going to be bad, really bad, like somebody's going to die or I'm going to injure somebody. This occurs with food, for example, which is if I swallow, I might poison my mother. And I have a saying that if you're under 12, they present as they can't leave the parent, often the mom. And if they're over 12, they just make all sorts of reasons they cannot leave the house. They stop going out, they start canceling friendship and sleepovers, things like that. Now, emotional lability is another one, and it's depression, bipolar presentation, mood disorder. Mood can be anywhere on the spectrum, and it can look hypomanic, manic for time, but then it doesn't stay there. And unfortunately, because of this, people get diagnosed with bipolar. They get diagnosed with DMMD, disruptive mood dysregulation, or DMDD, disruptive mood dysregulation disorder, which is kind of the minor version of bipolar. Many kids get all these diagnoses. Also, another section of 2 is irritability, aggression, and/or severe oppositional. So now we've got the mood, but it's accelerated. It's like a jet fuel under it. It's aggression, that bang, bash, break, hit. I had a complaint from a parent whose 5-year-old was beating her up. Now you ask, how does a 5-year-old beat up a mother? Well, they'd climb on top, they'd knock her over, climb on top of her, and beat the crap out of her. And this kid was 5. And this was, of course, a brand new behavior, totally unexpected and horrifying to all involved. Very oppositional, some of them. Another one, behavioral developmental regression. They baby talk, they thumb suck. You just go, they tantrum like they're 2, and you go, why are they acting this way? This is not the child I knew. Very commonly, sudden deterioration in public performance, in school performance, sorry. They look like they often have ADHD symptoms, but many of these children don't have ADHD until they have this illness. They could have had ADHD all along, so then it gets a little murky what's happening. But also things they talk about a lot, the measure, and we see, is short-term memory deficits. That's working memory, slowed processing speed. All of a sudden, they can't take it in at the rate they're supposed to be thinking about it. Executive function is really lost. So these are people who can't organize, even to the point they don't know how to get dressed. They can't get themselves together. They can't make a paragraph because paragraphs require first, second, third, fourth things in order. And they also have declines in visual motor deterioration. Visual motor impacts math and science hugely, or any diagram on a board that you have to look at and figure it out. I've had kids with math trophies on their bookcases, and they can't, algebra looks like Greek all of a sudden. You'll see if you have comparative studies between prior, like if your child already has an IEP for, like, say, dyslexia, you'll see drops of these areas in their IQ scores. I just saw one yesterday. The drop was 50 points between their visual skills earlier and their current visual skills. This is how it looks in action. So this is visual motor writing changes. This is a child whose normal ability to draw beautiful microscope. This is, she can't make 3 columns, and she can't, maybe that was a name there, or maybe it's just shield. You can't really tell. It's probably about a volcano. There's cinder cone, but you really can't know. Their lines are off. If you see young children, you could even compare coloring. Do they used to color in the lines, or can they now do?